talking about health care, and I think this is interesting. We've often said nobody knows the answer. Nobody knows how to fix it, because to fix it, you got to make it more affordable. To make it more affordable, you got to extract money out of that healthcare economy, and everybody wants all the money they can get. The hospitals want all the money they can get. The doctors want all the money they can get. The nurses want all the money they can get. The pharmaceutical companies want all the money they can get. The insurance companies want all the money they can get. Don't blame them. If I were in healthcare, that's exactly what I would want as well. But the only way to make healthcare more affordable is to extract money out of it, period. I mean, that's we can talk in a million circles and we can have real fancy conversations, but at the end of the day, the only way the healthcare economy becomes more affordable is the healthcare economy becomes smaller, period. Here's what I think we should do. Here's a starting point. I don't have anywhere near the answers, but I read a couple of articles. One was sent to me by a friend of mine in Washington, somebody who's real involved in politics. He's a part of a think tank. I don't think much of the think tank, but he's a part of a think tank. And he sent me some research they had done. And I read an article in the Wall Street Journal. Led me kind of down this road. And just, this is very random. And this is not an answer. But I think this is kind of a place that we could start. I think we need to do away with Medicaid and Medicare.
What?
Both. Do away with Medicaid and Medicare. Do away with the preferential tax treatment we give to employers who provide health care to their employees. Let's get away from the employer-based model. And here's what I'm asking. And then we'll figure out the details, and there'll be a lot of problems. There'll be a lot of issues. We'll have to navigate some real rough waters. But stick with me. Here's the two things we need to do. We need to do away and abolish today Medicaid and Medicare. They cease to exist. Poor people, Medicaid. Old people, Medicare. Now, we're redefining poor people, and we're beginning to redefine old people because we've not raised the age for Medicare. And people are living much longer. That's why we've got this financial ailment on our hands. And then let's do away with the employer-based model. Let's not give the preferential tax treatment to employers. Let's not force employers to provide health care under any terms or circumstances, period. It's up to you, Reverend. It's up to you, Alec. It's up to me, Ken, to figure out a way to go get my health care. But here's what we're going to do with the $1.2 trillion. That's right, $1.2 trillion. Rev, a trillion is?
1,000 billion.
A billion is?
1,000 million.
Okay. I just want to put that in perspective. $1.2 trillion is what we're spending on Medicaid and Medicare. We could take the $1.2 trillion. We don't have employer-based health care any longer. So you're not worried about your job. You don't worry about, does the health care at my job? Is that health care better at the other job? Well, I take this job because it has not so good health care. Do I stay at that job? The pay isn't any good, but it's got real good. No, we take that off the table. That doesn't matter anymore. We take Medicaid and Medicare off the table. We take the $1.2 trillion we spend on Medicaid and Medicare, and we give you a $10,000 voucher. The average American family spends $14,000 per year on health insurance. Now, we got to separate. Health insurance and health care are two different things. I've told you before, we're paying too much attention to the premium and how much the premium costs as opposed to the health care cost. You've got a $10,000 voucher. You shop your insurance. You have the right to buy insurance from Canada, Brazil, Nicaragua, Antigua, doesn't matter. Kansas, Oklahoma, doesn't matter. You've got a right to buy insurance anywhere in the world. If you're comfortable with the sales pitch or the line items they offer as part of your policy, that's your 10 grand. The employer is not responsible to give you anything. The employees, there's no tax advantage to the employer giving you this health care. And if we don't have Medicaid and Medicare, everybody's kind of an independent insurance buyer, purchaser. But you're not buying it with your own money. You're buying it with the money we were funding. And I think the employer base has created a lot of inefficiencies because a person using the insurance really isn't paying for all of it. Because the money's coming in a tax-advantaged way from your employer. So the three things we got to do, and once again, I'll let the smart people take over from here. I'll let the wonks get in the middle of it from here. But the two things we do is we take the employer-based model, we tear it up, We throw it in the trash. There is no preferential tax treatment to an employer for giving health insurance because we don't want you to give it. And then we take Medicaid, maybe over a 5-year period with grandfather, we phase it out. Medicare, the same thing. We don't have that. But every single family in America gets a $10,000 voucher, and you go figure out what is in the best interest of your family and your circumstance and your situation. And if you got to come up with an extra $8,000 or an extra $2,000, or if you figure out a way to get insurance on your family for $8,000, good for you. There's a $2,000 balance you build up. But the federal government, I mean, we're subsidizing health care, but we're not subsidizing it in the inexact way we're doing it now. Everybody's the same. You make $1 million a year. Now the debate will be, whoa. We got to means test a voucher. We got to means test a voucher. The person making $20,000 a year needs every penny of that $10,000. Might need more than that. The person making $100,000 a year, the person making $500,000 a year, there's some inequities there. So that will be the first debate we have. Do we means test the voucher or not? But I'm not a healthcare expert. I'm just somebody who does not believe in the preferential tax treatment we give to employers. And now we're mandating. I mean, we're forcing it. It's real expensive for business owners, incredibly expensive. We're talking about health insurance. We're talking about school board referendums. I mean, you're going to make business not for profit before long if we keep going down this road. And we're going very quickly and swiftly down this road, but you take the business owner off the hook. Guess what, Rev? He doesn't have to have all this paperwork, all this clerical work. He doesn't have all these regulations and bylaws and stipulations to abide by. He just basically says, I'm going to hire you because I think you're going to do a good job. I'll take this job because I think it's a good job. And we take all of that health care debate out of the equation. Can I afford to give my key employees health care? Do I have to give all my employees health care? What does Obamacare say on this? How many employees work how many hours? I mean, it's gotten to be so cumbersome for private sector business owners. You take that off the table. And let's take this business for an example. The three of us are in here. I have no idea what your situation is in life and don't care. I just know that the federal government, instead of spending money, instead of losing money by preferentially tax treatment on the private sector, businesses in particular, to fund to some degree, but a lot of that funds Medicaid and Medicare, and then other taxes go in there and fund it. We just take all that off the table. And I'm willing to means test. I mean, I'm willing to listen to that. I mean, if you want to begin, kind of the person who makes a lot of money doesn't get quite $10,000. The person who makes, very little money gets $10,000. I mean, maybe $10,000 is the peak. I mean, that's the most you can get. I just did the math. Every American household, you could give every American household $10,000, and it equals the money we spend on Medicaid and Medicare. You're going to gain some additional revenue by not giving the employer the preferential tax treatment, but you're going to take a lot of headache out of it. I mean, I hate to say this, people will lose their jobs because there's some businesses that have a clerk or an office staff just there to keep care of all. I'll tell you this, as a business owner, you make me that deal, I'd sign up today. I'd sign up today. You take the tax advantages of me not providing health care for my employees off the table, and I can streamline my business, I win. I think the private sector wins. I think the public sector wins. And I think it doesn't matter because a lot of healthcare providers, they'll tell you, we don't treat Medicaid patients because we don't get reimbursed enough. So what we've had to do is we've had to cost shift. We don't charge Medicaid patients enough, so we have to charge what? People who have insurance and pay, we have to charge them too much. There's a cost shifting. We take all that off the table. We force healthcare providers to list their prices. If you like this healthcare plan, Reb, and you've got a $10,000 voucher and it's $20,000, you got to come up with $800 some odd a month to supplement or subsidize that plan. But you've got your own insurance. You make your own deal. You deal with the healthcare community as you see fit. That's not the panacea. That's not the answer. That's not the end all or the be all end all. I just think that's the beginning. Abolish, throw in the trash Medicare and Medicaid, and do away with the tax advantages of the preferential tax treatment we give to employers. Give you a voucher, him a voucher. And I got no problem if I make a little more money than Alec, or if Alec makes a little more money than I got no problem with me getting $8,500 and him getting $10,500. But let's start there. I just think that is because that's where the inefficiencies are. the reimbursements of Medicaid, the reimbursements of Medicare, the reimbursements of insurance. And I think, you know, let's haggle over rates. I mean, I've said it before, and I'll say it again with all due respect to the one company who they know exactly what I'm talking about. We got a healthcare system in America today, and I'm a consumer of healthcare. Thank the good Lord, I've been healthy and have not had a lot of examples of needing it. But we got a healthcare system in America today that up until a year ago mandated that I buy insurance. I had no choice or pay a penalty. So I'm going to be fined if I don't buy something. And I had one company to buy it from. Now, you tell me what you think happens to prices if there's one company selling it and the federal government mandates that you buy it. That's not capitalism. This would be far more interesting. Now there'll be bugs in it. There'll be a lot of kinks to work out. But I think employers would like it. Their life gets simpler. Sure, they lose a little bit of that tax advantage. I think employees say, well, I mean, I can move to this job. I can try this other job. I don't have to worry about employers. And I'll tell you what, they're not going to like this at all. I'd include public sector workers. All these public plans, all these pension and retirement. We're talking about the school board referendum. One question I've asked, still ain't had answered. 30% of the budget is benefits. Everybody's treated the same. Private sector employees, public sector employees, everybody's the same. Everybody gets a $10,000 voucher. That's where I'd start. And there is no Medicare. There is no Medicaid. Back in a minute. Good Morning PD Live 95. Schofield's is our sponsor. We'll be back in just a minute.